Gavin Newsom has a new plan to cut the cost of one popular prescription drug as much as 90%. KTVU's Alyssa Harrington is live in Oakland with details of his plan to shake up the healthcare industry. Alyssa.
That's right. Governor Gavin Newsom plans to have California make its own medications, and the focus right now is on insulin, which would make a vial cost just $30.
This is a big deal, folks.
In a news conference held in Southern California, Governor Gavin Newsom announced the state will begin making its own insulin. The governor signed a $50 million contract with the nonprofit drugmaker CIVICA. By manufacturing its own insulin, the price for a vial drops to $30. A 10-millimeter vial normally costs about $300.
What this does is a game changer. This fundamentally lowers the cost, period, full stop.
The $30 price tag is regardless of insurance coverage. The insulin should be delivered sometime in 2024. And when it is available, patients can ask for the generic CalRx label at the pharmacy.
There were people choosing between rent or insulin, like was mentioned before, groceries and insulin.
Nikita Kalam-Harris, an advocacy chair for the American Diabetes Association, said she has given herself more than 60,000 insulin shots since she was first diagnosed with diabetes in 1999. That's while she was a student in college, and far too often she was scrambling to find a way to pay.
I would apply to enroll in clinical trials, hoping that I would be in the real insulin group instead of the placebo insulin group. I once went without insulin for just 5 hours, and I was in the ICU for 2 weeks.
This is really about changing the arc of the cost of health care for all Californians. And I'm proud that we're starting with insulin, but we aren't stopping there.
Governor Newsom is already looking forward to the next CalRx project, which is to make naloxone, or Narcan, used to reverse opioid overdose. That plan is part of California's efforts to tackle the fentanyl crisis.
Many questions still remain. For example, a manufacturing facility here in California has not been established. There also needs to be regulatory approvals. And the Legislative Analyst's Office has warned that California's entry into the market could prompt other drug manufacturers to reduce the availability of their drugs. Reporting live in Oakland, I'm Alyssa Harrington, KTVU, Fox 2
Yeah, we'll
News.
see how this all plays out, Alyssa. Thank you. Today's